Hello, and welcome to this video introduction for essay number 4 for University Seminar 275 Scientific Ethics. So the idea for ethics number 4 is cord blood banking the next miracle of modern medicine? And so what I want you to do, so hopefully you've already watched this already, but if not, rewatch it. Or watch it for the first time. Watch The Ethical Dilemma in Science, Cord Blood Banking, More Than Just Stem Cells. And so this was posted on Canvas a little bit earlier. And so you should be able to take a look at that. And then in addition to that, I want you to consider the rules, the laws associated with eminent domain. Now, eminent domain is something within the Fifth Amendment of the U.S. Constitution that allows for the government to take private property and convert it for public use. And so a couple landmark Supreme Court decisions related to this, the original in 1875, Cole versus United States, comes up with the kind of justification that the government can truly seize the property and convert it, seize private property and convert it for public use, as long as they provide just compensation to the owner. And that concept of just compensation then continues to be a little bit controversial in and of itself. What is the value that needs to be provided to the owner? More recent Supreme Court's decisions related to this, Laredo versus Teleprompter Manhattan CATV Corp., basically allows the government to provide compensation regardless of the size of the property or if the seizure does not greatly affect the owner's economic interests. And so basically, you gotta, allow, or the government's got to provide some level of compensation, regardless of how big or how small or how important or how, not important the property is that they're taking for public use. And then finally, the most recent Supreme Court case, at least of the ones that I'm going to be presenting and talking about here, is Kelo versus the City of New London, Connecticut. And in this Supreme Court decision from 2005, so roughly a little over 15 years ago, said that the general benefits of economic development qualifies as public use. Now, previously, eminent domain has been used to, obtain areas for building highways or, putting in public parks or, in some cases, other types of kind of traditional public uses, public use spaces available. This is basically saying that if you go through and kind of develop an area so that you have a region of commerce, you're going to be promoting public use and the public good. And so from this perspective, what I want you to do is think about this situation. Is cord blood banking the next miracle of modern medicine? And in this, I want you to write a short essay of about 500 to 750 words, so roughly 2 to 3 pages, in which you can consider the following scenario. In order for cord blood to be an effective biological source of cells, tissues, and organs for replacement treatments, a greater number of people must opt into the donation program. We need the people to have provided these cells in order for them to be used in the future. And we still run the risk of not finding, matches if we don't have a large number of donors being present. And this is especially true if we look at minority and ethnic groups that often have difficulty finding appropriate donor-recipient matches. If we can have greater compliance, greater participation in these donor programs, we increase the likelihood that these miracles of modern medicine would be available equitably throughout our society and our community. And so the question that I want you to consider within this essay is, how do we increase the availability of stem cells in these public cord blood banking programs for future use? And so as a follow-up to that, I'm again providing you some prompts. Again, you don't have to use these prompts. They're meant to kind of start you thinking about the question. You can go through and use this, but if you've got another approach that you want to take to answer this question, please take that other approach. I want this to be an opportunity for you to personally consider what is going on in this area. And so the first prompt is basically the question of eminent domain. Should the perinatal medical waste tissues, so basically if they're not donated, they're going to be disposed of and cremated. They're basically going to be burned and disposed of. So should these perinatal medical waste tissues be claimed by the right of eminent domain? We saw in that last court decision that economic development is currently considered an appropriate use of eminent domain. At some point in the future, could the contribution to overall community health by increasing individual fitness be considered a public interest or a public use? We're going to minimize the toll on society that illness plays if we can decrease the detrimental effects of that illness, if we can improve the quality of life of individuals. Is that promoting kind of the overall public good, the public use within a society? Are biological tissues considered property? We've seen a whole variety of ways in which we can think about that, both now and in the future with some of the examples we're going to have within the course. But are these, waste tissues, they're coming from a body, they're coming from the mother's tissues and the child's tissues. Are they considered true property? Are they something that is protected, that we need to be looking at some level of compensation? And then finally, what would be just compensation, appropriate compensation for things that are going out in the trash anyway? They're going to be discarded. And so what is the value that needs to be replaced if the government claims these through the right of eminent domain? So again, that's one prompt. That's one approach you can take with this question. And again, you don't have to do that if you've got another approach you want to be taking. A different approach, instead of the government doing this, should we think about either healthcare systems or health insurance companies? Should they be allowed to require cord blood banking to protect against future costs of medical treatments while waiting for a match on bone marrow transplants? It's very expensive to treat a patient that is sick and in need of a bone marrow transplant. And if we've got this pool of potential cells that are being used in the treatment of those patients, we could potentially save a lot of medical expenses if we were to move forward with that. So should insurance companies be able to say, okay, as a buffer against future costs, we want to start collecting this and we're going to absorb the costs so we have it available, but you need to be able to provide this. If we look at this program, it could have, either a carrot or a stick. The carrot, the benefits for the donor could be, potentially reduced or discounted healthcare costs for life. Potentially provide a carrot of a financial bonus if the cells are used. You bank your cells and it's there. And similar to the concept of eminent domain, if they're actually used, the family or the individual that donates those cells would receive some type of incentive or financial bonus for donating these cells. And again, that would hopefully increase the desire to participate in these programs. The other ways we could look at it, there could be sticks associated with it, mandated by law or mandated by the conditions for your insurance coverage, or potentially the public health need. But you got to do this because it's the rule. It's what everybody has to do. Another stick may be that, we need you to donate these cord blood or we're not going to be able to give you future healthcare treatment. At some point in the future, we are going to be using these regenerative techniques, and I'm speculating now, but in the future, we may be using these techniques of stem cell replacement therapies. And we need the cells to be able to work with that. And so, you've got to do it, or we're not going to cover you for these procedures going on in the future. Now, if we did that, again, the argument would be what happens to the family that, is too old to donate these tissues. And they would have to have some type of grandfathering clause where the family would continue to be covered, perhaps just going forward until we've had enough time to collect the tissues and have everybody kind of in the program. Or it could be that, the family will continue to be covered as long as new individuals that are born within that family are in compliance and donating their blood cells. So again, you don't have to respond to either of these prompts, but they're there to help you if you're trying to figure out how to get started on this question. As always, if you have any questions, reach out to me, send me a quick email, and I'll reply back and keep you on track. So thank you and have a great day.